Vineet, I'll come to one aspect which the economic survey also pointed out, which is the importance of Gen AI and the impact of Gen AI on jobs. On one hand, we do have an employment issue, and the government has come front and center and put forward this scheme. On the other hand, the economic survey does warn about the possible impact of Gen AI. What is where do you stand on the Gen AI and factor and its impact on jobs?
There are lots of jobs that will go away with Gen AI, that's for sure. Um, and those jobs will get repurposed into some other jobs. For example, prompt engineers for Gen AI. That's a big job by itself. Apart from that, so I'm not an expert on that, but I can definitely say if you want some product delivered to your home, Gen AI can't do it. You still need someone to do it till we get robots and other things that proliferates across all modes and it gets to your household, even if you're living on the 20th floor of a building. So there will be jobs that are there that are needed, and the difference has always been employment versus employability. There are people that are available. We recruit about 700 people a year, 700 to about 1,000 people a year. But we have to put them through a training program for a year, literally, to really get them to a certain speed. When we talk to students who've graduated from colleges, some of them don't know who the President of India is. So there is a huge gap there. So skill enhancement, adding to skills, upskilling, reskilling are things that will be required, and certainly Gen AI will help in that process. I do not think it's going to be negative initially. If you ask 10 years from now, perhaps there could be an impact. We are a country that is going to require a lot more jobs than we can even think about. And perhaps in 10 years, we will definitely see a challenge.
In healthcare, of course, Gen AI is a big advantage, Ashish. What are your thoughts on that?
So in healthcare, specifically few specialties like radiology, where the AI is started to interpret the radiographs, MRIs, and CTs. That came very handy in a epidemic-like situation. And of course, the tele-ICU and telemedicine, and how the softwares are able to read through the patient's vitals, the thermographs, all those things are actually, reducing the burden of already, burdened critical care teams. So that is an upside. Of course, somebody who, takes up, the advantage with AI, tries to reduce the footprint of manpower working for the patient care. But yes, on the other hand, we would require a lot of new jobs, which would be required to maintain these systems, software, and continue to evolve. Because AI in healthcare, of course, we have to take it with pinch of salt. Sometimes the reporting can go haywire, and they may report a normal X-ray as a cancer patient. So those things, the human intervention will always remain till we are very sure the algorithms have matured enough so that they can time and again, with almost 100% accuracy, they are able to predict as a clinician because the multiple variables depending on the age, the disease and other patterns, the AI has to keep on evolving and learning. I think that would require a few more years. But yes, it is surely going to impact the manpower setting, of course, the training levels of the people who are going to get involved in with these modern systems in place.